were you first diagnosed with ameloblastoma?
So I was first diagnosed in 1977 when I was 22. I had an ingrown wisdom tooth, and when the dentist was removing that tooth, he saw something kind of suspicious and did a biopsy.
Did you know about ameloblastoma before you were diagnosed?
No, I didn't know anything about it.
How many times has the tumor reoccurred since that first diagnosis?
So there's been two reoccurrences, one in 1985 and then in 2003.
What symptoms have you experienced?
Were no symptoms at all. I didn't know I had the tumor.
Did the tumor affect the mandible or maxilla?
The first time the tumor was in the maxilla, and that's where the wisdom tooth was in the was an upper wisdom tooth. So that was removed, and they thought they got everything at that time. The second occurrence was also in the maxilla in 1985, and it had grown well up into my sinus area and was starting to reach up into my nasal kind of the bone area above.
What was your experience with treatment the second time?
So the second time they had to, it's always been surgery to remove the tumor, never radiation or chemotherapy. So they had to cut me from here, up my lip, around the edge of my nose, all the way up here, lift it back. It was called lift back surgery. And they had to remove part of the maxilla, the bone, and the tumor in the sinus area.
What side effects have you had from the treatment?
It was all surgery, so I had to heal from the surgery. And that took several months. And, I had to have prosthetic denture prepared for me, so I had to go through quite a few months of preparing this kind of false sinus cavity that would fill the hole and give me resonance to speak. And
what types of doctors treated you?
So first of all, it was a dentist, just an ordinary dentist who found the tumor initially. Subsequently, I saw a variety of plastic surgeons or a different specialty called head and neck surgeons. So plastic surgeons and head and neck surgeons kind of worked together on the surgery. And then there were some specialists in the dentistry area that built the reconstructed dental appliance, and they were called prosthodontists.
How has it impacted your everyday life?
So it's had a big impact. Since 1985, I've had a removable apparatus inside my mouth, inside my head, that when I take it out, I can't speak very clearly, but I speak professionally for a living. It's really been something that I came to learn how to live with and not be afraid of, and simply to do the work that I do, whether it's speaking in public or speaking on the radio or in some other way. I've been told that people can't really tell that there's anything that is different about my speech.
Due to some of the visual side effects from the surgery, how has the tumor impacted others' view of you?
Sometimes people ask me about it. Sometimes I expect people are curious about it because the third surgery was in the mandible, and it took a piece of bone and some tissue out of the lower area of my jaw, and that did affect the nerves on the side of my face a bit. So I have a little bit of a droopy side of my face, and some people will comment on that from time to time. They think maybe I've had a stroke or something called Bell's palsy, which can But it's neither of those, and so I'm happy to talk with people if